My name is Althea Taylor, and I chose to present on Unit 7, which is Outpatient Services and Primary Care. So, the article that I chose to review was Patients Face Long Delays for Imaging of Cancers and Other Diseases. It starts off by talking about patient Michael Quintos from Chicago who was struggling to get a diagnosis despite his chronic pain and symptoms because he was unable to get the diagnostic testing that he needs. This was an issue that many Americans were facing in late March due to shortages of contrast dye that is used in various diagnostic testing. Throughout the pandemic, both patients and healthcare employees have really struggled with shortages of many medical items, including various PPE items, with some of them being N95 masks, surgical masks, gloves. There have been shortages of ventilators for ICU patients, various medications, testing kits, and so much more. This specific shortage of contrast dye was a result of a COVID outbreak in Shanghai that shut the factories down for weeks. Some background, some of the uses for contrast dye are CT angiograms to look for blood clots or any type of internal bleeding. Other types of contrast CT scans, which help detect infections, bowel obstructions, GI issues of that sort, as well as various cancers. And it is also used for cardiac catheterizations. As you can see, then, this shortage affects a wide range of specialty care that was being taken care of in outpatient settings, including GI, cardiac, and oncology. This shortage has made doctors and other healthcare professionals have to ration and rank patients based on priority out of fear of not having enough materials, which there already is somewhat of a priority basis within healthcare, especially in emergency care, but this has made it significantly worse. Again, not only this shortage, but all of the shortages of medical supply have led to this priority ranking system in patients. And seeing that the most severe and life-threatening cases are seen in the emergency department, that is where most of the testing was being reserved for and used at. An example of this that they gave in the article was a patient who fails an exercise stress test could potentially be dealing with a cardiac issue. However, they would need further diagnostic testing using contrast dye in order to get to the root of what the real problem is in order to be able to treat it. But that dye is being reserved for patients who come into the emergency department with heart attack symptoms who need that immediate care or their life is in danger. So those people who could potentially have an issue are not receiving care. In our textbook, Delivering Healthcare in America, A Systems Approach, it talks about the 5 different classifications of outpatient care, the 5 being clinical, surgical, home health care, women's health, and traditional emergency care. It then goes on to explain how outpatient clinics are the safety net for communities, mainly in inner cities, where there are a lot of uninsured and generally a lower socioeconomic population, and seeing that they use these clinical outpatient services the most, these underrepresented and less privileged populations are then the ones being the most heavily affected by shortages like these, where the majority of materials are being held in emergency services. This is posing major concern for doctors, not only with this shortage, but all of those that have come as a result of the pandemic. They fear that patients who are currently unable to receive the testing and care they need, or have previously, because of the pandemic, not been able to receive that, will actually end up with worse or later stage conditions as a result. Contrast dye, which is the shortage talked about in this article, is used to diagnose cancer, for example, which can spread very quickly. So a delay in testing could lead to a patient not getting care until they are in a further stage and it has spread in their body and they need more care. This also goes for various other autoimmune diseases and cardiac issues, really anything that worsens with time. For example, with the autoimmune, if you're not able to get the testing and figure out what type of autoimmune disease you have or what medicines you need to be on, whatever area of your body that is being attacked, it will continue being attacked over that time and it could create more damage. In the textbook, it talks about how new technology has allowed for diagnostic testing, imaging, and surgical services to keep people from needing to be admitted for inpatient hospital stays. And we want this not only because no patient wants to spend a night in the hospital, but financially it costs significantly less money to take care of patients in an outpatient setting than inpatient. So both private and public insurances push for this outpatient care. And so the push for outpatient care, including these diagnostic testings, has led to us being able to do these preventative measures, treat these patients so that they don't get to a critical point in their illness where they have to have an overnight hospital stay. So this also then brings in a financial aspect to these shortages, seeing that if we can't take these preventative measures, such as a patient who failed the non-stress test, if they later have a heart attack and need to be admitted to the hospital, that is significantly more costly and taking up more resources within our hospital. And the last thing that the article really touched on and wrapped up with was one of the main reasons why these shortages of medical supplies are happening is because many hospitals rely heavily on one supplier. So if anything happens to that one supplier, they are largely and critically impacted. And that is what happened in this case with this factory in Shanghai being shut down. It affected us so much. There was another factory in Milan that was trying to use emergency services to send over more, but there was not a plan in place for a situation like this, so it was not able to get done in time. And this was really an issue in the system that was overlooked until the COVID pandemic, because previously there were not many things that would result in shutting down an entire factory for weeks at a time. However, now with COVID being so easily spread and the lack of information, it is now happening all over the world. And so in this article, they related it to the formula shortage, where there are few suppliers for an item that is in very high demand, which creates shortages whenever there are issues in a factory, such as recalls in that situation. And they go on to say that they feel like this needs to be changed so that in the future we are not so heavily affected and we are not this reliant on one supplier for our needs. And I believe that is all. Here are my 3 references. Thank you.